Welcome. The session is Environmental Justice, Air Quality, and Health. Is community science the key? So that's the session you're in right now, and we're about to get started. And I have at my far left, I have Omar Mohammed, who is the president of Low Country Alliance for Model Communities, all the way from North Charleston, South Carolina. And then I have Dr. Anna Rue, who is an associate professor at Johns Hopkins University, Bloomberg School of Public Health. And then I also have Dr. Sacoby Wilson, who is a professor at the University of Maryland. They will be telling us about their experiences in using community science, the best practices, lessons learned, and how we can use this tool to help environmentally injustice communities around us. So, which order would you guys like? Okay.
Cool. Hello, everyone. Hopefully you're having a good day. We had to make some changes, but hopefully everybody's enjoying the sessions and had a chance to do some networking. You're getting more chance to do networking at 5 o'clock during reception, so a little bit more time before the keynote starts. But in this session today, we really want to talk about, as Rosemary mentioned, who's one of my PhD mentees, that we're talking about environmental justice and what are solutions. And one solution is community science. What I'm going to do first is give you a little bit more setup, and maybe I'll skip some slides because it's like one of my base PowerPoints. I kind of use the same slides just to talk about EJ issues, but dig more into citizen science. So just to kind of start out, and I'll not cover a lot of this. What's up? Is it working? Okay. So I always like to start out my slides with talking about, environmental justice movement and how it started, just to frame, particularly important to frame this session. So you've heard us talk about EJ issues. I didn't go as deep into like the background and history, but for me, the movement in many ways began, contemporary movement began with Dr. King's work with the Memphis sanitation worker strike. And, the 5th anniversary assassination was last year. And really about how he was working with workers, sanitation workers around exposure issues, labor issues, how they weren't being treated like humans. So you heard me mention earlier what I call my Earth Day speech and preach. That's what that was this morning. I talked about the fact that we have to look at people's humanity, and really I draw that from this slide. So you see men who were walking around saying, holding signs saying I'm a man, and basically they were treated less than human. And really thinking about environmental justice, it's about making sure that we recognize and value people's humanity. And so you have Dr. King's work, and then you look at the work of Dr. Bullard and also Dr. Benjamin Chavis. You see Dr. Chavis pointed in this picture here. And so the reason why I mentioned Dr. Bullard, just a little bit of background on the EJ movement. In Houston, Texas in the 70s, many of you are familiar with Houston. Houston's the only city in the country, a major city in the country that doesn't have comprehensive zoning. So if you think about issues of where hazards go, many of you have been aware of the leaks, the chemical leaks in Houston. And you see some of the administrators who get on TV say, oh my God, I have no idea this is a problem. Why didn't you know? Houston has the largest petrochemical corridor in the country. So that's not by accident that these incidents keep happening in Houston. And with Dr. Bullard's work in the 70s, he found that, but regardless of income, all the landfills in Houston are built in the 70s are built in Black communities. So it didn't matter, lower income, middle, didn't matter. And then those, the history of the environmental justice movement. There's other, parts of the movement out there, but one of the major events that really brought the national attention was the PCB. What happened? Did I do something, Rosemary? Oh man, okay, it just disappeared. Okay, I don't need the slides, but useful y'all to have the slides. But PCB, which is polychlorinated biphenyls, the PCB landfill fight. in Warren County, and folks are basically fighting to stop these contaminated dirt from being brought into the community. And you see people laid across the road to stop the trucks from coming in. That landfill was eventually built. All landfills leak. It also leaked, and it got closed and cleaned up. But this is where in many ways people say the EJ movement, the more contemporary EJ movement, started. Y'all know what environmental justice is. I just like to highlight real quickly this first definition, and I think we may have EPA colleagues in here, is the definition of fair treatment and meaningful involvement in all people, regardless of race, ethnicity, culture, when it comes to enforcement of laws and regulations. My students have heard me say what I'm about to say. I hate that definition. That's the kumbaya definition. We know that folks are not, the laws are not being equally enforced. So I'm gonna borrow from a comedian who borrowed from another comedian. It's like the whole thing about the whole all lives matter, Black lives matter. We know all lives matter, right? But we're saying, for focus, to be specific, Black lives are not mattering. That's why we have a Black Lives Matter movement. Another way to say it is, as a comedian said, you may have a partner who says, "Do you love me?" And you respond, "I love everybody." That wasn't a question. Specificity. Do you love me? Focus on the issue, right? And the second definition was coined by Bunyan Bryant. This, in many ways, I really like this definition better because it speaks to the issue of social justice. It speaks to the issue of social determinants of health. EJ is serving people can realize their highest potential without experiencing the isms. EJ is supported by decent paying and safe jobs. So economic determinants, right? Quality schools and recreation. Housing. You heard the assistant secretary this morning talk about housing issues. Healthcare. That's been a discussion that's come up a lot in this session, in this meeting. Democratic decision making and personal empowerment. Violence, drugs, and poverty. Those are psychosocial stressors, right? Those things are important. And we're communities where both cultural and biological diversity are respected and distributed justice prevails. This is a definition really talking about reparations too. I don't know if I said reparations earlier this morning, I'll say it now. The Green New Deal is about environmental and green reparations. Not about giving people checks, but about investing in communities. And part of the reason why we have environmental justice is because the lack of real investments in these communities. So let me keep it moving. I'm gonna skip this. So what can we do? So this session is talking about community science. I'm gonna do maybe slightly academic-y kind of talk, and Rosemary, keep me on time because I'm actually tired. I'm talking slower than normal. Those who know me, is that right, Omar? And yeah, I'm tired right now. I'll say I ate a little bit, so I'm tired. And I got the itis so tired. So this is probably good for y'all who used to me talking too fast. So what can we do? I said in an earlier session, in my work, I do community science. A lot of my work is based off this community engagement continuum. So as you move from left to right, trust, communication, transparency increases. So the first is outreach. Outreach is very unidirectional. So you may have an educational program, you just give information. Community's not giving you feedback, right? That's not real engagement. You got consultation, where you may get some feedback from community. You share information, so it becomes a little bit more bidirectional. For those of you who do research, community involvement is more when you have like advisory board, right? So many of you know about community advisory boards. You may have an advisory board where you may push present your studies to them, and they give you feedback on that. Now, I own the two, not sure why this keeps happening, but it's fine. The two right panels, as far as right panels, participatory and community driven. So participatory is more bidirectional. That's where we have participatory action research. You may have heard that term before. PPSR, public participation in scientific research. You also have another term, CBPR, community-based participatory research. So that falls there where the community is really engaged in all stages of the research process. And then at the end, you have community-driven. And that's where community really drives the whole research process. Now, normally at this point in time, I would give a personal example of how that works out. But since my spouse is actually in the audience, I would not use that personal example. She's told me about not using that personal example about how we first started dating and we were courting and, and then she was far away and she moved closer and we broke up. And we didn't have trust. She didn't really know me well. And then I asked her to marry me on Valentine's Day and she said no, right? Because she still didn't trust me. And then after I got finished the PhD, she said yes, because she knew I had goals. right? So that's an example I always use. So this is the first time hearing me use that example. You're being embarrassed. That's what you get for coming to this meeting. So the reason why I use that example is partnerships, engaging communities about relationships. So what are the best parts of relationships, right? Trust, transparency, communication. I think some of you heard me say it earlier. Some Aretha Franklin, say it, y'all. Respect, right? Respect. Those are the things that make good relationships. Those also are the ingredients of good partnerships. Okay, so you're doing community science. You have at the core have good relationships, and that has to be something you do that you commit to doing that. And as scientists, we have to commit to doing that. Now we get to CBPR. Here's a classic definition of it. It's really about. I'm not sure what this is. But it's still on over here. That's just weird. Okay, we're going to keep it moving. So local community knowledge is valued. You've heard folks say, like Esther and other people say, the laureates say, we live in the community. We live in the community. That's just bad, y'all. We live in the community. You need to value our expertise, okay? We also, when you're doing this work, CBPR, community members are not subjects. That's a problem. That's a problem. People are participants, okay? They are participants. And the researcher is not the expert. I know a lot about a little bit, and I could talk well about that little bit that I know y'all, those of you who know me, but I'm not an expert in everything. So really, the community members have the expertise. We have to rely on their community knowledge systems, their cultural knowledge systems. They should be driving the work. Their knowledge should be the core of the work. But my knowledge is what I call more general knowledge. Community members' knowledge is what we call more specificatory. Just saying specific. I see it again in the corner of my eye. Not sure what that means. Yeah, this is not good. So y'all have slides too. Okay. Rosemary, we need some technical assistance. See if you can help me find the people to help with this issue. Thank you. Go ahead, Rosemary. I need your help. Okay.
You're fine.
Okay. You know what? See, that's the problem, Rose. That's fine. I got you, Rosemary. Then also, when you think about the work that we do, and make sure you give me the time too. So you got, as a scientist, we focus a lot on science of inquiry. Science of inquiry. I'm gonna look over here, and when it goes out, I'm just gonna look and go back. Okay. The science of inquiry. Did this happen in the room earlier today?
No idea.
This is the first, so it's happened for me.
No, it didn't happen earlier.
It could be a short. Yeah, that's okay, y'all. I can't use that. So I'm gonna use this. This computer is fine. It's something with the projector.
Are there student union staff for
Yeah, that's.
IT stuff? I'll go find
Yeah,
someone.
thank you. That's what I was asking Rosemary to do. Rosemary. So let me tighten up. Okay, so a lot of times in academia, and this is actually the biggest issue with the symposium, this screen. Okay. Like I said, we focus a lot on science of inquiry, knowledge production, but we don't focus enough on other dimensions of science. And I think that speaks to the culture of academia and actually what we incentivize. What we incentivize is part of the problem. So when you think about the science of integration, that's been interdisciplinary, and it's really about making sure that you say the problem is a mountain, and you have to have multiple disciplines with their pickaxe working on the mountain. You cannot have this one discipline. So you have to have a more prismatic, multifaceted approach to address the problem. You have the science of teaching, you have the science of engagement, and the science of application. So for me to do good community science, you should be doing all 5 dimensions of science. And I think you're getting that out of this meeting today. You're hearing about these issues. You have to translate this information to action. Hold on a second. So another issue, and you can't see the slide, so sorry about that. Another issue that I want to talk about real quickly is how you do engagement bridges. So in many cases, as scientists, Is there we can turn this off? Are y'all gonna be fine just looking at the computer? Okay. You gonna be fine?
No, I need my lights, but that's okay. Somebody's coming.
Okay, cool. I call it the two hands of engagement. So on one hand, you have the issues, impacts, opportunities, benefits, and partnerships. So what are the issues in the community? What are the negative impacts? What are opportunities to collaborate? And when you think about opportunities to collaborate, we have to talk about what's your why as a scientist or from another field, and what's the why of the community. So sometimes the whys may not match up, but you want to make sure the whys are congruent. So my why may be I want to study air pollution. Your why may be something differently. I want to improve air pollution. I'm trying to study it. You want to improve it. See if we can work together to figure that out. And then when we're doing this engagement work, we can sometimes as a scientist, I may go in and work on an air pollution issue. It may be another issue of importance in the community. So how do you connect to those issues of importance? Those bread and butter issues that someone said earlier: food, faith, family, health, and jobs. So how can you connect your work to food, faith, family, health, and jobs? You can connect any issue almost to those things. Those are core issues for communities. And that's what the priorities are. So how can you match what you want to do to their priorities? So another thing in this work that there's a type of community science. It's known as citizen science. Citizen science is probably not the most inclusive term, so that's why this section is called community science. So the traditional thing about citizen science, that's bird watching, right? Folks out doing water quality sampling and monitoring, but it's emerged to be more expansive. And the great thing about community science is, and it can really lead to democratization of science. So it's all about how we can make sure everybody has access to science. And when we do that, we will make sure everybody has access to science. This is more difficult than I thought it would be. Trying to use this computer. Yeah, so is it?
I think this still works with that.
Yeah.
Sorry.
Okay, that's fine.
I mean, to switch this.
Did you check with them yet?
Yeah, Ian sent someone to IT.
Okay, so my presentation has been butchered. Hopefully y'all will be fine. Okay. So when you do, I want to now kind of dig into, and Anna will talk about this a little bit more, but when we kind of take this community science framework and apply it to working on air pollution issues, I think what's important is you got to think about, who are the key stakeholders you want to engage. Some of the stakeholders could be the community. It could be local policymakers. It could be regulatory agencies. What are the decision-making processes you want to use when it comes to monitoring? What are the relationships that you already have in place? Maybe you have relationships in place and maybe you don't have relationships in place and you have to build those relationships. What are the resources you have available? In many cases, those resources could be technology resources. It could be staff resources. I think one of the really important aspects to think about is from the study implementation. So what are the residents' concerns, and make sure those concerns are informing the study objectives. What's your monitoring plan? What's the performance and data quality? I'm gonna let you speak more about that. I'll skip that, right? Data management analysis and communication dissemination. So when you think about the monitoring plan, and a lot of our work, we engage community members to help develop a community-based monitoring plan. So to make it's there. Who knew? Community-based air monitoring plan. So that's that where community engaged research, again, that community science comes into play again. And in addition to that, once you collect the data, it's important to report the data back to community in the form that's useful. One of the problematic components of a lot of what we're doing with air quality monitoring is there's a lot of data, but then you do the analysis, but then the analysis, when you report it back, you don't visualize it, put it in a form that's useful. So how can you make the information actionable? We have to make the information actionable, right? And you have to engage your community partners to figure out how it can be actionable. The goal is, how can we use air pollution data to increase people's critical literacy? What I mean by that is, you get the information, now you get people to turn their windshield, what's up? Say it again? Well, you're supposed to give me time. I'm gonna take 5 more minutes. Because we have more time. And so, how do you increase people's critical literacy on these issues so they can actually have the agency that needs the information for some type of action, okay? And if you go to my next slide, 'cause I think it'll work, and I'll let Anna speak more about this.
But go through it because it's
Yeah. So when you think about monitoring that's being done right now, a lot of cases when you have environmental communities with environmental justice issues, you may have factories that are already in a location. And what happens with the way the EPA does monitoring, the monitoring stations are in sparse locations. So that's one problem. And then when a new factory is going to get a permit or they're going to do expansion, what they do is they'll use the data from that monitor that may be 20 miles away. Okay? That's called exposure misclassification. So you're saying it's 20 micrograms per meter cube, 20 miles away. It's 20 micrograms per meter cube in my house. Or better yet, it's 5 micrograms per meter cube, 20 miles away, and it's 5 at the location of this new factory. That is bad science. So from an environmental health science perspective, I want y'all to say it's exposure misclassification. For community folks, for those who are going to be fighting for change, say bad science in, bad policy out. Bad science in, bad policy out. Okay? And so this is the acronym stand for. So usually the EPA, the best monitor, most accurate use of regulations called Federal Reference Method Monitor. That's the FRM. So you go from left to right. You have FRM, you have near FRM. The FEM is what we call the Federal Equivalency Method. It can be substituted for FRM. So these are most accurate, most specific, don't have bias. You can use the data for regulations, lawsuits, etc. Then you get to what we call near FEM and then indicator grade sensors. Indicator grade sensors are less accurate. They have more bias under different temperature conditions. They have less specificity. Some of you may know about some of these they call like the air beam, the purple air sensor, but they're useful. And so you look at this inverted pyramid, you have, so what's the impact of using this community collected air quality data? Education, awareness, empowerment, public health research, local ordinances, regulations, lawsuits. So for me, as you go down, you have to have more accurate data, more specific data, less biased data. So you can use the indicator grade monitoring for education, awareness, and empowerment, but that's where you have your most impact. And then you can do near FEM for more public health research, see, as you go down. And then you want to maybe get the FEM for local ordinances and regulations and lawsuits. So FRM, near FRM. But the point is, even if you don't have FRM data, you can impact ordinances, regulations, and lawsuits by having people who've gotten indicator grade data up here and been educated and improve their literacy. So once you improve their literacy, improve their agencies, there can be more people doing public commenting, more people at those meetings, more people running for office, more people who are aware, who then can say, hey, well, we got this indicator grade sensors. If I co-locate it, if I do monitoring at the same location with an FEM grade sensor, I can correct my data that may not be as good with the indicator grade and use that still for public health research, local ordinances, regulations, and lawsuits. So don't let the EPA or state agencies fool you, right? They saying, well, your community collected data is not good data. It's all about the quality assurance, quality control. I'm going to talk more about that. All about the quality assurance and quality control. But what's important is no data is infallible. Industry data, government data. It's all about your QA/QC. So we have to push back on that when that comes out the playbook. They use it a lot. Okay. So let me speed up because Rosemary said I'm already over time. So just a few communities where we've done community science. Some of you have met Omega Wilson with the Western Environmentalization Association. I talked about them earlier in the presentation. And basically, they are a community unincorporated where a highway been built through them. They did not have access to sewer and water infrastructure. So this is a community group that I've been working with since I was a grad student. So over 20 years. Okay. So 20 years ago, started working with them 20 years ago. So I just want to mention them because they're the group that, remember I talked about from left to right, the type of science, the gold standard, community-owned and managed research, okay? So here's community-owned and managed research. Chris Haney, I think is in the audience. Is Chris here? Chris and I worked together 20 years on this work. And so here's the framework that was developed, that the community developed. Chris and I go back and forth about legal or legal-based epidemiology. We also came with this concept with Omega Wilson. And it's about how you use the data, exposure data for compliance. This is saying that you don't get stuck with the causality trap with health. You got to show that exposure and disease association. Because remember, a lot of these communities, these chemical mixtures and these air pollutants, there's so many chemicals in the air. How do you know what chemical caused what disease? What combination? So we want to say use the exposure data to then see, are they out of compliance with legal code, zoning codes, infrastructure codes, housing codes, environmental regulations, Title VI, etc. That's why y'all are here, to understand how can we use data with legal tools to impact change. And lawsuits are a legal tool, but that's not the only legal tool that you have. Okay. So let me skip. Sorry. Did I just mess it up? Dang it. So through this work, we were able to slow down this highway from being built. We were able to get people's first-time installation of sewer and water infrastructure. Uniontown, Alabama. Anybody from Uniontown? Alex is here. Some other folks are here. Just want to say that we're in Uniontown trying to help out too during air quality monitoring. Some of you may have been in Uniontown session earlier. So this is the landfill where this is all the fly ash, the 4 million tons. That's the mountain of fly ash right there. They are spraying cheese effluent and human waste. That's human waste on the ground. The landfill is built right on top, right by the cemetery, Plantation Slave Cemetery. And that is a photo of all the human waste basically accumulating. Okay, so we're doing some air quality monitoring using a combination of air beams and purple air sensors. And we're going back July 9th to do PM, particulate matter monitoring, VOC monitoring, and also ammonia and hydrogen sulfide monitoring. So we're going back July 9th to help with that community. So let me skip this because Anna can talk about that. So Brandywine, some of you may be familiar with Brandywine. Anybody from Brandywine in here? I talked briefly about Brandywine earlier. So just to mention Brandywine real quickly, unincorporated community. Here's some of the hazards. This is a flyer the figure that Commuter developed. So just real quickly, 3 power plants in 3 mile radius, 1 coal, 2 gas power plants being built. Sludge lagoon, Superfund site, fly ash landfill, 3,500 diesel truck trips per day right now. That's going to increase once the gas-fired plants are opened. Here's some maps of the facilities that are being built. You can see how close they are to one of the local schools, so not that far away. And just the interesting point about the fly ash landfill, the only community park in Brandywine is right beside the fly ash landfill. And of course, the land for the community park came from the fly ash landfill. It's part of a community benefits agreement. And outside of that, they also gave the kids jerseys and gave the community turkeys. Why do they keep every black community give turkeys away? Turkeys and jerseys. It happens. Y'all. Some of y'all don't want to talk about turkeys and jerseys. So that's that. So I just want to end there. So I just want to give y'all a little bit of background on this community science. Thank you. Anna's going to dig into this more. I'm hoping her slides are fine. And then Omar is going to speak about the work in Charleston. And I've been working with Omar since 2007. I'm not sure why. That's weird.
Yes, it
Okay. Thank you. That's the Peanut Gallery. Actually, her nickname is Peanut. Peanut Gallery right there. Thank you, Ariana. Made me feel better about myself. Technical difficulties.
All right, so like Sacoby said, I'm gonna go a little bit more into some of the aspects that he mentioned. I'm gonna just talk a little bit about what exposure assessment is and where and how EPA and your local agency, depending on what you define as local, how they measure some of the equipment that they use, how else can we measure, which Sacoby already mentioned, and talk a little bit about local sensors and what we can do or need to do to ensure this quality assurance and quality control, and other things that we need to consider before even we start taking any measurements. So we call exposure assessment it's like the investigation of the crime, right? So what is the contaminant? Which are the sources? So once you know what the source is, you can pinpoint a little better what your contaminants are. Which is the environmental media of interest? Are you interested in air or in water or in soil? Depending on what the concern is, then you can target it a little better. If you know anything about the fate and transport, where it comes from, how it gets to where it's going, and what is the end product or the end consumer or the end person affected by it, and what are the routes of entry to the body. Typically, when we're talking about air pollution, it's because we're interested in inhalation, but maybe these fly ash deposits on surfaces, and there's kids playing in the playground, and they have this hand to mouth. Yes, it's happening. And so you need to know all of these so that you can see what is the best approach to assessing these exposures. And so when you are measuring, then you also need to see how often, how frequent, how many people. So what is the magnitude of the impact and the variability? Does it vary in time and in space, or is it very stagnant? Is it kind of constant, a constant insult, or is it spiking? So EPA, as many of you know, EPA and the local agencies have a series of different networks which are actually exquisitely designed. They spend millions of dollars and many, many, many hours making sure that these are well placed, that represent some area. There's state and local area monitors. There's photochemical assessment monitoring networks. There's the interagency monitoring of protected visual environments. It's called the IMPROVE network. And as you can see in red, each of them is targeted to measure slightly different things. So some of them are for mainly urban locations away from point sources. Some are more located close to point sources. Some are like in the state parks, so to measure secondary contaminants, so more of like a quality, environmental quality more than impact health. Some are more to rural locations. However, all of those, and actually they look a little bit like this, depending on the site. Many of you may have seen these trailers located, some in more urban areas, some not. Inside the trailer, there's a whole bunch of instruments that measure different things. Like I was saying, like exquisitely accurately. The gas monitors, for example, are based on the spectroscopic method. So depending on the gas that you're interested, you can select a specific frequency, and then ozone selects a different frequency, that NO2 or nitrogen oxides or sulfur oxides. And so each of those gases is measured, but let me just keep going. And then particulate matter is measured also with these very high-end instruments that you may have seen. Most of them are collected on filters, and then you can analyze the filters, or you can have these other direct reading sources. But the problem is that they are designed to capture large area averages. So they fail to capture local sources. And as you all are very well aware, if you live in Baltimore, even if you live in Baltimore City, which has 3 of these monitors, chances are your personal exposure is not represented by those monitors. It's more of a local thing that is captured. So they cannot provide communities with either timely or, useful information. So also the data, if you look at the EPA site, the data takes about a month to get there, because they do, and it's good that they take this time to assess the quality of the data, but it just means more delays. So that's one of the reasons that there's now many, many, many options for us. And I just put some of them here. It almost looks like every day, if you go into the internet, you're going to find a couple new ones. But these are some of the ones that the scientific community actually has used and validated in some way. So there's the air beams, the dilos. Actually, I think the dilos was the very first one that came into the market. On this side, I have more of the portable ones that you can bring with you and take some measurements. The newer ones are actually combining, the first ones only measure particulate matter. The newer ones actually are integrating a little bit of gases and particulate matter. These are the flow, the atmotube, the aeroqual. And then on that side, I have some that are a little more stationary so that you can put in your home, for example, and the purple air, which is regional. And I'm not actually going to talk a lot about it, but there's like a worldwide network of sensors to give you an idea. But the purple air, I think, is mimicking a little bit of what the EPA monitors are doing. They just have them, a little more of them around. So one of the things that we need to focus is before we even attempt to take or to buy a sensor, what are we interested in? Because if I am going to buy these VOC sensors, but my main pollutant is particulate matter, then I'm going to spend money unnecessarily. So what is the actual question that I want to answer? Who is affected? Will the exposure? Where is the exposure, right? What type of measurements are needed? Like I was saying before, it depends on what the pollutant you're interested in, which quality, like Sacoby was saying. Am I going to go into, like, is my end goal litigation? Then you probably need a little higher quality and spend a little more money so that you have, or at least have a very strong quality control system in place. Where should the measurements be taken? Can I go into the space where, for example, if there's a new source being set up in a community, how close can I get to the source? Am I going to do fence line monitoring? Am I going to do a distance from the source? How many do I have to sample? How often do I have to sample to get a representative effect? And by the way, all of these, I'm not making it up, and I'm not pulling it out of my sleeve. It's actually in the EPA Air Sensors Toolbox, which is a very good resource. And you can all go in, and they don't give you a lot of detail, but at least there's a pretty comprehensive list of things that you can do. So once you have decided what the sensor, and of course, you're pretty well aware, you need to figure out ahead of time what kind of funding sources, what kind of knowledge I need to have. Can I do it by myself, or do I need to partner with a chemist or with an epidemiologist that is going to be able to analyze the data and give a little better sense of what it means? So all of these, if you figure this out ahead of time, it's going to save you a lot of headaches. Some important things to consider, and it's a little bit repetitive. Oh, I don't know. Okay. So one of the things I wanted to highlight here is it's better if you know the levels, the normal levels of the pollutant. So, for example, before a new source is put in place, hopefully you get ahead of it and take some background measurements so that you can show the impact, or at least not maybe not show, but maybe at least assess the impact. Is there going to be a difference before or after? Kind of makes sense that it will, but you will have an idea of how much of the impact that was. It's really important to develop standard operating procedures so that you're following a specific protocols that you can defend if that data is challenged. And you can say, these were my procedures that I followed for calibration, for making sure that my data was spot on, right? And if you don't know how to use it, there's plenty of resources that can help you to receive training. So so say you have already solved all of those issues, and now you have your 3 or 4 sensors. What am I going to do with them? Where should I put them? Sometimes it's better to scope it out a little bit and delay your hard start to figure out what are the places that are going to give me the better data. So, for example, don't put it somewhere in a corner because the corner is not going to have enough airflow. So put it a little bit where it's going to be, like open to the air. How many am I going to set up so that I can have a good sense of the difference in distance from the source, for example? Like I was saying before, assess the background. If you are measuring gases, and this is across all of the gases, if you're measuring gases, all of these sensors are very sensitive to relative humidity. And for all of us that live in the East Coast, that's not trivial. Relative humidity is a really, really important issue. So if you're going to measure a gas, make sure that you're also measuring relative humidity, because you can actually correct for it. But if you're not measuring it, you don't know what the impact is. Then if you're measuring personal exposures, make sure that you're going to have, wearing not inside a purse, because then it's not going to have enough flow. It's got to be exposed to the air. Maybe you want indoor and outdoor to compare and to see if the impact is higher indoor or outdoor. And then I cannot stress this enough. Take some preliminary measures. So take only a few and look at the data. Does it make sense? Is this what I was expecting? Or maybe there's something wrong. There's something wrong with what I'm doing, or there's something wrong with the instrument. So check it out before you have hundreds of data points, and then you're in trouble, because then it's really hard to go back. So calibration, as I was saying, that calibration doesn't have to be super, super complicated, but it has to be done well. So typically, calibration involves having a known source, having a gold standard. And sometimes that's really hard to get if you're a community member. Where are you going to get your source? Where are you going to get, if you're measuring ozone, where are you going to get your known concentration of ozone? That's really hard. So maybe partner with somebody in a university or at the Maryland Department of the Environment that has an actual ozone monitor. And maybe you can co-locate your instrument with one of those monitors. That usually works. Although calibration usually involves having several points, more than one point. But it's not impossible to do, but you have to just figure out how to do it. Many of the gas monitors have just 2 points, which is called like a bump calibration. So you get like a baseline 0 and then a high point. And then you compare those two. If those two are accurate, then you're pretty confident that the range in the middle is going to be good. To evaluate precision or the variability between your sensors, you need to test that unit multiple times at that concentration and see, okay, every time I put 5, am I getting a 5, or am I getting sometimes 5, sometimes 50, sometimes 500? Then I might have a problem. But if my variability is within 3 and 6, maybe I can work with it. So you have to know, it's important to know what your precision is. And this is not complicated to do. This is actually pretty simple. You just have to repeat the measurements several times. And then for bias, that is a little more complicated, because if you don't have a gold standard, you don't know what your bias is. So you may be getting the same answer every single time, and you're just like, I'm good. But it turns out that is the wrong answer every single time. You're not so good. So you need to, in this case, definitely make sure that you're co-locating with a standard reference method or some other source that you're at least confident. And you have to repeat it several times, because just because it did it 3 years ago, there's no guarantee that it's going to keep doing it forever. So you have to continue to have a plan, at least, to measure every month. Some sensors are good for every year. Some sensors you have to repeat every month. So you need to know your sensor. So for example, we co-located 3 different sensors. I think this is PM 2.5, yeah. So 3 different sensors. You have one in blue, one in red, and one in light blue. And if you look at the 3 different sensors, they are actually pretty much on top of each other. They're not too bad for low-cost sensors. And then we compare that to an EPA sensor, which is the black line. So they're going up when the black line goes up, the sensors go up. When the black line goes down, the sensors go down. But there's a gap. So what was happening there was the relative humidity was interfering. once you correct it for temperature and relative humidity, you can see that now they're more or less on top of each other. So we needed to also collect relative humidity, otherwise we wouldn't have known that. So there's, like I was saying, there's ways to do it, and a lot of the new sensors are coming with better tools to be able to account for those things. But you have to know that this can be an issue, and you have to be ready to measure that additional thing that you may need to. Because if you don't have that relative humidity data, then you can't control for it. So, like I was saying, data maintenance of your sensor is really important. Review your data, right? Look at it before you have hundreds of thousands of measurements so that you can correct if something is going wrong. Also, you can detect if maybe your sensor is drifting. Maybe you don't expect any difference, and some of the sensors drift even north or south. And so these kinds of things, you start to get familiarized with your sensor. You can detect them. And like I was saying, data validation is really important. Check for interference. Check for visually if odd patterns. And that's it. I actually have another one that I put at the end, sorry. But some really good EPA resources are down here. So there's the Community-Focused Exposure and Risk Screening Tool, CFIRST. They don't have every single community, every single pollutant, but it's a good resource. The EnviroMapper, also they put a lot of information from EPA monitors into these maps. EnviroFacts. I was playing a little bit with those first three, and you have to be very patient. It's not trivial. It's a lot of time that you have to put in to figure out. It's time consuming. Some of the data sets are outdated, so you have to be aware of that. But I definitely highly recommend this air sensors toolbox that the EPA put right before the Trump administration took over their website. So it's still there. It's not being updated as often, but there's still some EPA people at the EPA that are doing really great job. So thank you.
Okay, cool. Thank you. Hey, Chris, how you? Bye. Okay. All right, so I'm Omar Muhammad, the Executive Director for Low Country Alliance for Modern Communities, and I am also the project coordinator for CCRAB, which stands for the Charleston Community Research to Action Board. That's the community advisory board that Sacoby was mentioning. So all research goes through that group for approval before the community participates in any project. So I first want to orient everyone to our community. So downtown Charleston, if you're familiar with the area, does this have a light? It does not. To the bottom heads towards downtown Charleston, and as you move to the north is North Charleston. So we work in 7 communities, and those communities are highlighted in the different colors. Our most northern community we work in is Liberty Hill, which is at the top, and that is one of the oldest settled communities in the Charleston area. It was settled by freed slavesmen, and these communities are constantly dealing with not only legacy pollution, but industry, factories, other types of cumulative impacts in their communities that impact the quality of life of the residents. So as you can see, the community is surrounded by different types of contributors that impact their quality of life. A port that is expanding to that side of town. In fact, that port was regulated to be across the river on a more affluent part of the city of Charleston. And because of political connections and wealth, they were able to shift that project to a less affluent community. So those communities are dealing with a port. They're dealing with an intermodal facility. highways, trains. So they're dealing with a host of different types of concerns. So LAMPC's work, basically our purpose is to build healthy families. That's ultimately what we want to achieve at the end of the day, is to build healthy families. And we build that by creating opportunities in our community to assist them to be able to improve their quality of life. Our work is intentional and it's transformative, meaning that we just do not do activities to do activities, but we want to empower the community as well as address core concerns around poverty and why people are trapped in generational poverty. So that's the main focus of our work. We focus on 7 communities and 4 core concerns. And the community actually helped us kind of develop this framework. That's the list of the communities, and our 4 core areas. We concentrate on affordable housing, economic development, education, and environmental justice. These are core, fundamental kind of areas that keep people trapped and keep them in the conditions that they are. So people, and you can use those also to elevate people's quality of life. So this work is very challenging. This is our theory of change here. And like Dr. Wilson before, and the reason I put this here is that before you can build any relationship with academia or any other groups, it's important that people who want to come in and do community-based research, that you understand communities have different levels of capacity, and understand where they're at when you go to them with a suggestion of partnering with them. Because a lot of times communities think that they have the capacity to do certain work, but they struggle internally with resources necessary to complete a task or complete something timely, or being able to have people that's knowledgeable to be able to walk through that process and step. So this is very complicated, because even organizations like ours, where we have been working in these communities for 12 years, we still struggle with this. Because communities move throughout that process. You can engage them, educate them, and empower them, but a new issue come along, a new concern that comes along, where you have to go back through that process again and re-engage and re-educate, and then hopefully at the end of the process that they are empowered. And a lot of times, the main challenge is identifying who are the leaders in the community. A lot of people will step up and say that I represent this community, and they do not have the trust of the residents. And that causes a lot of concerns when you move into this work, because you lose the trust of the community when you develop a relationship with an individual or groups that the community do not value. So it's important that you take different strategies in building those authentic relationships and communities. So I'm gonna talk a little bit about NEPA, because this is what really thrust us into the citizen science process. NEPA stands for the National Environmental Policy Act. And when the State Ports Authority was looking to expand in the city of North Charleston, they had to go through a permitting process for their project. And we were able to use NEPA to mitigate. So the community actually mitigated the negative impacts from the State Ports Authority. And subsequent to that, we mitigated the impact with Palmetto Railways that resulted in $8 million for the communities. So we were the very first community-based grassroots organization that successfully used NEPA for community-based mitigation. But NEPA has been around since 1976, I believe. And our question to EPA and other regulatory agencies, why did it take so long for mitigation that is part of a federal process? Why did it take so long for a community group to be able to use that to empower their communities and address their concerns? So that's something that we're still working through with the regulatory agencies. And we have some strategies in place that we plan to to address that, but that's a long-term goal to try to get to policy. I'll be talking about both of these at the next section later on today. But citizen science. So the built environment in our communities, the communities in which we work in, they had to deal with an incinerator. It was the only incinerator in South Carolina. It was the only trash burning incinerator. And this incinerator was built in the 1960s. And it had a 40-year contract. And then I think back in 2000 and I want to say 6 or 7, their contract was being renewed, and the community galvanized around that and was able to stop the contract from being renewed. So that incinerator no longer exists in the community. The community also deals with cement plants. That particulate matter is constantly being dispersed in the community. It has fly ash that sits on the facility. Railroads, and you see how close those railroads are to people's homes. So you can imagine trying to be able to, your quality of life, how your quality of life is impacted by railroads being, 50 feet away from your front porch. So the diesel emission, the vibration, the noise, all that impacts your daily quality of life. And people are stressed with that. So that stress adds to their potential negative health outcomes. Highways, and then the school here is built on a capped landfill. So these are local land use decisions, right? Poor local land use decisions. So how we began to engage the community. Remember, Dr. Wilson stated that environmental justice is the meaningful engagement and the fair application of rules and laws and regulatory processes. So we meaningfully engaged the community and we involved them in that work. So these were a couple of students that were hired to do some block assessments. So they did they ground truth some data and collected data and was able to analyze that data. We also had SWOT analysis, so we helped the community to identify their strengths, their weaknesses, their opportunities and threats. That's an important process because not only are communities threatened, and not only do they have weaknesses, but they also have opportunities and strengths. So we need to elevate that as well as we are elevating those other types of issues and concerns. And community workshops, project displays, and also visioning sessions also help to shape a lot of the work that we do. So getting down to the citizen science part. So we, like Dr. Wilson said, we use the community-based participatory research model. We also use the community, the one that EPA came up with. Collaborative problem-solving model. Yes, the community-owned, managed data. We use that as well. So this is a training that we did with the Medical University of South Carolina, where we were looking at heavy metals in the water and how that impacts communities when they're out fishing or shrimping or doing some of the other activities. Because the communities that we work in have deep roots and connections to the Gullah Geechee culture, which they're connected to the water. So they are not. They do not practice catch and release. So, a lot of communities, we catch a fish or we catch something and we release it back. These communities, what they catch, they eat, they consume it for dietary needs. And during this study, when we were designing the study, we thought that we had more trouble getting hair follicles from the residents versus collecting their fish. We thought it was going to be easy getting the fish than the hair follicles, but it was the other way around. People were more willing because you get into people's private space, their space. But people were more willing for us to collect the hair follicles than their fish. So that enforced for us that people are actually eating what they're catching. So it became more important for us to understand how legacy pollution from factories and industry have impacted our waterway, and then how that can again impact people's health, particularly when they're subsistent communities. To the far left, this is a study we were doing with our community around soil sampling. And the person in that picture is Herbert Rahim. He's one of the founding members of our organization, and he's a environmental engineer. But we were out collecting, and we trained. How many people we trained, Sacoby? We trained about 60.
I forget how many, but we trained a lot of folks.
Yeah, we trained a lot of people on collecting soil. So the community residents, collect the data. We train them to analyze the data. We train them to interpret the data so that the data means something to them. And we're just not throwing data out to data sets and information to them, but they actually participated in collecting it and analyzing and interpreting. And it means something to them when they're actually out there helping to collect the data. And these are students here that are doing GIS, and I think GPS, right? This is Dr. Paget, right? Yeah, Dr. Paget from the University of Georgia, Tennessee State. He was doing the training with the young people on GIS. And then this is her training here we did on air beams. Dr. Wilson and Dr. CJ came down and helped us with this training of the residents and some other user groups for that. And the one on the far, I can't see that.
That's a young version of me.
Oh, okay, that was a report out. That's a meeting we had in the community where we were collecting data, and this was one of the report out meetings. So Dr. Wilson, really held to that practice of collecting data in the community and reporting it back out. And that was a challenge early on. A lot of, groups would come and extract information from the community, but never would share that information back. In the community, we have concerns about, they took this study was done, but we don't know what happened with the data. And it just leaves a lot of unanswered questions. These are some of the monitors here that we use in the community. These federal reference monitor and some other types of mobile source monitors. This is Scott Reynolds from DHEC. He was in the community training the residents on air monitoring and particulate matter and how to go about collecting air data. This one in the middle is some of the sites. The red dots are the 3 sites that we had in the community for these stationary monitors we have. And the one on the far left is, of course, the air beam. And we still use those today. Dr. Wilson in the University of Maryland donated some Atmo tubes and Purple Air. And I think the second generation of air beams they donated to us. Yeah. So what does all this mean? If we collect the data in communities and communities feel like their quality of life is not being improved, then why are we collecting the data? And how do we build on citizen science that has been conducted in communities? So we realized early on that land use drives a lot of the concerns in our community when it comes to where things are sited, roads bisecting the community, trains, rail yards, all types of different types of facilities that impact people's quality of life. And how can we as an organization help the community to address that, not only through data, but also through policy? And what we did was about 5 years ago, we secured a little mini grant from a local foundation, and it was 3 phases. The first phase was to collect a community-based health survey. So we need our own health data, because looking at the census data, looking at CDC data, you really could not get to the granular level of the community. And that's what mattered to us, was what was happening when it came to health for the community, not at the census tract. That tells you something, but it don't get you down to where you need it to be. So we developed our own community-based health survey. So that was the first phase. The second phase was to do personal air monitor. So that was part of the air beam studies that we did. And then the third one, which we are working on now, we kind of concluding now, is to understand the impact of zoning. The impact of zoning in our community. So we did a zoning analysis project, and we brought in the College of Charleston, a GIS professor there, as well as an intern from the College of Charleston. She produced a capstone project based on this work for her master's thesis. So doing this, what we found is that over time in our communities, siting of facilities are getting worse. But in more affluent communities, those sightings are getting better. They're actually producing more green space. The zoning that happens in their communities is being downzoned. But in our communities, we're seeing upzoning. And when I mean upzoning, I mean taking residential or business zoning to light industrial and heavy industrial. And in the more affluent areas, taking those heavy and light industrials and downzoning them to business, green space, conservation types of overlay districts, those types of zoning. This project demonstrated that event is happening. Before that, we would have to go and make a case every time someone would want to upzone, and that's a lot of that takes a lot of time to go to zoning meetings, because it's just not one zoning meeting. You have to go to city council, you have to go to their public safety meeting. So it's a lot that you're asking community residents to commit to just to stop one project. And maybe 6 months later, you have to do it again for another project. So how do we start approaching this differently and address? So this was one citizen science project that we were able to successfully do. And I think that's the end of my, yep. So thinking differently. This is the last one. Thinking differently and ensuring that communities benefit from projects. So we talked about the mitigation, how we were able to secure funding for communities, but sometimes mitigation doesn't always mean funding. It may mean putting amenities in communities that address those quality of life concerns. So we're actually working with a church that owns a brownfield to develop a park in the community, a green space that they need. And we also, 2 weeks ago, just signed a community benefits agreement that outlines those priorities right there. And the number one priority was to keep trucks out of the community. So I'm gonna stop there.
You're not gonna talk about the solar farm?
Oh yeah, we're doing a solar farm. So up the street from this site here, the church owns another brownfield. I just don't understand how churches want to get into the brownfield business. I mean, it's not a lucrative thing. I just don't know why churches want to own brownfields. But for some reason, this church owned 2 brownfields, and they really did not have a plan for how they wanted to clean the site up, how they wanted to redevelop it. It was just some land that didn't cost a lot of money, and they were gonna get it, and they thought it was gonna be something they could just, do something on. And they found out that it's just not that easy. I mean, brownfields are depending on what it is. We're fortunate that this is just a petroleum site. Petroleum sites are a little bit more easier to deal with than some other types of brownfields. But the other one, we'll be building a community-based solar on that other one. And we're doing that because we want the church to be able to generate some resources for itself so that it becomes financially stable, and it can do more to help the community. And we also want to generate revenues for the community to be able to address some issues around housing and economic development. So those are some things that we're talking with the church. But these are different approaches on, Sacoby mentioned reparations, right? These are different approaches to how we can, repair and restore harm that has been done to groups over time, and build in equity and build in and address those inequities that have been created through policy. So I'm gonna stop there. Did I leave you enough time? Okay, cool.
Q&A time. See, if slides work mostly for you, they work all for you.
I think I was enjoying this session more than every other person because I got carried away with time and I didn't stop them. But we still have about 10 minutes for questions. So if you have questions.
20 minutes. This is 3:40.
Oh, I thought it was 3:30. Okay,
But
cool.
we can get out of here 5 minutes early just to make sure the transition to the next.
Yes, Professor.
Okay.
Noted.
Go ahead. 15 minutes. Go
So if you have questions.
Yes, question.
This is a question for Omar. I was wondering if you could talk a little bit more about that study and the reaction to it. Was the zoning agency and the city just up in arms? Did they acknowledge that this had been happening? Did it lead to kind of systemic changes, or was it just kind of published and everybody's like, yeah, we know that's what's going on, and
Yeah,
things are
so
kind of business as usual?
yeah, so this research is fairly recent. We just went live with this
2 days ago.
about 2 days ago.
Oh,
So I sent the email to Sacoby and EPA
I was
and
like, ooh.
yeah, so this went live just about two days ago. Before I came up here, I was in New Jersey for another conference and drove down here. But before I left to go there, we were meeting about how we release and launch this. That was launched about two days ago. So it's relatively fresh, but we have been having conversations with the city zoning. We have gotten mixed reactions. Of course, the zoning, we have some progressive individuals in the zoning department, but they can't do much if the administrator is not giving them the kind of support that they need to make those kind of changes. But fortunately for us, the city of North Charleston is undergoing their 10-year review of their comprehensive plan, which we plan to make this heavy component of our discussions with the city of North Charleston with their comp plan. Although the comp plan is not a legal document and they don't have to follow the comp plan, but the comp plan, when zoning is reviewing an application, they look at the inconsistent or the consistency of that application with the comp plan. So it can go to your benefit or it can be used against you, right? But those are discussions that are ongoing.
Yes, Denise.
Omar, this is to you. So there was one slide that showed community mitigation equals 8 million. Is that amount that you want or did you get?
That's the amount that we got.
You got?
Yes. So we right now we have $4 million that we have now.
Okay.
The other $4 million we're still waiting. Palmetto Railway still have to get their permits and kind of things like that. So they're still waiting on, I think, the Railroad Administration to give them the final approval, and then those monies will be released over time. So we fully have all the mitigation dollars for the state ports authority. And right now we're deploying those funds to build housing. We have been able to acquire 35 pieces of property in the community where we're building affordable housing. 2 of the houses come online this year. We have given out $30,000 in scholarships to students. We're going to send 3 adults to try to attack. We're going to pay for whatever classes they have through that money. We are paying 21 adults to receive their GEDs. And for the environment, $100,000 of that went to our research group to do air monitoring, and we set up an air monitoring network, which involves EPA, DHEC, which is the state regulatory agency, University of Maryland, Medical University of South Carolina, University of South Carolina. All of us have gotten together, and the State Ports Authority and Palmetto Railways. We all formed this North Charleston Air Monitoring Network so that we don't replicate effort, that we complement each other air monitoring.
So is this something that Professor Wilson is working with some of our organizations? Could we replicate that mitigation plan?
Yes.
So let's put that on our list
Yeah,
We use a lot
all the
of
best
it.
practices that we're trying to do in one place, we're trying to bring. That's why I brought folks from outside to come here so y'all can talk. Okay.
Thank you.
I had a hand up over there, so.
A lot of citizen science is data collection and learning protocols of that, but the analysis, the data cleaning, statistics, mapping is done by quote unquote expert scientists. But you mentioned how you included that, so I'm very interested in how you did that, how you handled the training, licensing or access, that type of thing, and how did it work out?
Yeah. So we use we lean heavily on academia when it comes to life, because we can't afford to buy a GIS license that we're going to use maybe one or two times. So we lean heavily on academia to carry that burden, right? We lean heavy on MUSC when we use low-cost sensors and there's a potential hotspot that we are concerned about. We lean heavily on them to come out with more robust tools that can get at if this is a concern and do we need to do a more in-depth study. And training the residents. The residents, particularly if they're going to be working with hazardous material, they get HAZWOP training, they get all that training that they need to handle potentially hazard, like the soil. We didn't know if the soil was going to hit heavy metal in it or not. So we trained them on HAZWOP, how to train potentially hazardous material. The residents we have experts that come in, Dr. Wilson, Dr. John Pierce, other individuals that come in and actually walk the community through the process of collecting and interpreting and adapting, and what that data potentially can look like and what is it saying. I mean, you could throw a chart in front of the community and they see the lines and they see the bar graphs and everything, but they don't know what that is saying. So when they come in for a training, they actually get to walk through what is this graph saying to me and why is it important that this information is, what is it saying and why is it important? So we have had some challenges with that. Some of the challenges is academia.
Which ones?
We have had a lot. We have had a lot.
He's not talking about me.
No. Not Dr. Wilson. Dr. Wilson is really.
Are you sure?
June 1st, Rosemary.
Other academia that don't understand community-based participatory processes and principles of EJ. They don't understand those things, and they come in with their academia biases, and inequity is built into those systems. That although we help to write the proposals, we put as much time and effort into writing proposals and submitting the grant, and we get less dollars than academia. Academia, you get 60% off the top, and the community gets 20.
20,000.
No, we get 20%.
Oh,
20%. And that,
you know
I don't even want to talk about that one.
I'm
I
sorry.
didn't want to talk about that one. So those inequities that are built into the funding. But it's not only at the university level, it's at the funder too. So it's the federal government or whatever entity it is that is managing that process. How do you build equity in when community, when academia is building a partnership with communities? How we plan to get around that and build up a more robust pipeline of citizen science, scientists for the citizens and residents, is that we're working with the College of Charleston now on Environmental Justice Academy that teaches leadership skills, how to power map your community, just different types of processes that we have learned over the time. And EPA helped to put together some of these modules too, but we're building in some things from our learned experiences into this academy. So it's going to be hosted at the College of Charleston, but what we're planning is that we realize that people have barriers to get into places. So if you're talking about a rural community or you're talking about a community that's far away, they don't have travel dollars to come to Charleston and to stay for 3 days, right? So we plan to move this around using the modern technology that we have, so web-based types of trainings, and moving the modules around to different educational facilities. So hosting some in rural areas, hosting some in other parts of the state. So that's one way where we want to kind of build this pipeline of citizen science in
Take
Charleston.
that model north.
Yeah, I'm pretty sure that model could work up north.
We are trying to do that here.
Oh, okay,
Gotta
cool.
gotta get the funding for it.
Yes, sir.
So I've got a citizen health science study that I'm doing in North Birmingham right now. But I'm dealing with a situation where it's legacy pollution for over a century. And where do I get my baseline? Because that's absolutely missing. There is no baseline in that situation.
So, are you the community that's dealing with the facility right near the playground, the school?
That's
Dr.
me.
Like Dr. Bullard?
Dr. Bullard.
Okay, cool.
Yeah, I
So,
brought him in.
so I think part of it is, so I went to Alabama A&M undergrad.
Okay.
So my first question is, and this is the question I talked about the Uniontown session. Why aren't our local state universities in Alabama? I'm from Mississippi. I'm not from Alabama. I'm from Mississippi. It's the same state. Fold over.
Yeah,
Same state.
The same industry,
It's
it has the same stronghold.
So my first thing is it should be the UAB has one of the largest federal grants in the country when it comes to schools of public health and universities. And have they been engaged in providing any research services to your community?
UAB started doing a research project, and Alabama Power shut them down and closed off the research project and hid the data from the community.
Mm-hmm.
We don't want to have anything to do with that, so we can actually get it done and put the data into the citizens' hands. So we're trying our best to stay away from UAB, government.
UAH too? What about UAH? UAH as well?
Let me put it this way.
Yeah.
The study is IRB certified. We could not get anybody in Alabama to certify it. We got it through Indiana University.
And that's what our colleague
Dr. McNichol.
that's another colleague. So I don't know. So we have another colleague from Indiana who's actually helping us in Uniontown with soil sampling.
Okay, yeah, no, I'm not saying.
So I'll give you a little bit of what I said to Dr. Bullard. I want to help, but if I do add it on, I'm going to pop. That's why I told him via email. Because I'm underfunded, under-resourced. So a lot of what we do is actually provide a lot of technical assistance, but we not really been getting a lot of funding. But I'll say this to you: we want to work with y'all. And you remind me, I said this.
Yes, Professor.
I'm going to remind you too.
So we're flying into Atlanta July 9th. We're driving to Uniontown that day. So we could probably do a stop to talk to y'all in Birmingham. So what I can do is I'll send the students to go to Uniontown, and I can stay in and talk to you and your community in Birmingham while we're in town.
That'll work.
Okay?
We'll make it happen.
Yeah, we'll make that happen. I'm
Yes,
still gonna pop.
yes, ma'am.
Well,
And I was gonna say-
I mean, we're already, in the process of pulling it together and getting
Yeah.
the community involved.
So we can help.
So it's not a thing where you're gonna have to
Do everything.
do a whole lot.
Okay, yeah. So
I've got a team that's doing that.
Okay.
And so, yeah.
And
we
then
definitely
I,
get
I,
help.
I,
I was gonna say,
I still have one more question
No,
on
wait,
this
wait,
side.
let Audie
Oh,
Let me just
sorry.
follow up really quickly. And I remember Steve Wing actually, because Sacoby's professor, mentioning many times because of the money that is coming through the universities is the local money, right? So in North Carolina, the hog industry was impeding his research because they were just threatening with taking the money away. And so I think if you could partner with some private university or outside university, I think that could help. But and there should be a community that is similar in characteristics that there should be somewhere that doesn't have that legacy.
Well, that's part of the problem in Uniontown. The reason why we have outside universities coming in the state is the same thing you're dealing with.
You thinking that?
Can't get real help within the state.
I came in from Atlanta and immediately I saw we're not gonna be able to get the state to work with us. We're gonna have to embarrass the state.
Okay.
So it's just about exposing
Yes, sir.
that whole the whole hiding information, everything,
sir.
make them look bad, and maybe they'll do something.
We can work on that. Let's take this last question.
Yeah, so real quick, thank you for all the panelists, it's been very informative. I have a question, it could be for anybody, but perhaps maybe directly to Omar, I'm not sure. So I've been appreciating through this conference the importance of multiple stakeholders as well as multiple pronged approaches. And you mentioned partnership with academia, but I was curious, do you also have partnerships with those in the legislature that kind of floated that 10,000 feet? And if so, how far up the food chain are they to really make an impact in decisions, and how difficult is that?
Yeah, so that is very, that's a good question. So, politics is tricky. Because if it doesn't benefit the politician and getting reelected and staying in power, they're not going to have anything to do, right? Two, if it's pushing back on potentially money from an industry that they receive contributions from, they are more likely to try to talk you out of pursuing than to continue, even though these may be their constituents that are being impacted. So we take our approach is that we have internally within our organization, we have a report card for every local, state, and federal delegation that represent our communities. And we have certain things that we're looking for. So how they voted on certain things. And we grade them. And based on that, when they're up for re-election, we have a slate of candidates. Now, we don't do it as a nonprofit. We do it as personal citizens. We have a slate of candidates that we run. And we almost flipped City of North Charleston County Council, City Council, using this strategy. Because we felt like they were ignoring the concerns in our communities and we needed to change leadership. And we almost flipped that council seat. We won 3 out of the 6 that were running. And that turned their perspective of our organization.
So let me just interject. I know we gotta go, but I just want to follow up on that point and get y'all out of here. We are actually in the process of working on a formula, an EJ scorecard. So you actually just make it, our scorecard sound much better than what it is right now. But it's to focus on the state. But that same formula could be applied to the federal, like you said, state and local. But we're working to publish it so people can duplicate and then do the same thing that you're doing. What you need to do is flip, folks. What you do in Uniontown is to flip it by giving them a scorecard. You embarrass them, here's your score, and then you have people run against them.
Exactly.
So we're gonna get this scorecard out. This is another one of our projects that we have, but that actually is really powerful. So we can share that with folks. It's another tool. This event, what I want y'all to get out of this, I hope you got this Symposium conference is, we're trying to get y'all tools, best practices, approaches, methods you can use to be empowered to impact change. Okay? So, Rosemary, close us out.
Thank you very much for staying and listening to them. I'm always like that, especially when I listen to community partners like Omar, Omega, Brenda. I'm always blown away by the wealth of knowledge they have. Like we always believe and we know community has resources and they can give us more information than we can ever gather from any study. Thank you.
Thank you, everybody.